Few more voyeurs fascinated by the sight of fully figured women. Someone always wants to check Kanyimbao's status on Facebook, doesn't know why. And another one loves looking at the shoes that people wear. Whatever it is, just make sure it doesn't develop into an obsession. Moving right along now, South Africa is becoming the ideal tourist destination when it comes to cosmetic surgery because of medical excellence and the facilities that are available in the country. We also offer modern private cosmetic surgery clinics with access to the latest technology and treatments. And now we look at how popular cosmetic surgery is in South Africa. And we'll also hear how non-invasive anti-aging procedures are being received by the public with founder and CEO of Skin Renewal Clinics, Dr Maureen Allem. Welcome to Afternoon Talk.
Thanks, Karabo. Thanks for having me on your show.
Is going under the knife slowly being replaced by non-invasive anti-aging procedures?
You know, Karabo, it just depends when you start all these anti-aging procedures. If you start earlier, then you shouldn't in 10, 15 years have to go under the knife because you've actually prevented your skin from sagging. But if you come at a much later stage and you look in the mirror and you see there's lots of excess skin, excess folds, excess fat, then you are going to have cosmetic surgery. So it's best to start younger when the skin has a much better ability to rejuvenate. And then hopefully down the line we won't be needing these facelifts when we turn 50, 55.
So tell us about Botox.
Okay.
Because I mean it's becoming the rage, and there are few people that I suspect use it.
That's quite amazing. People won't admit that they're using Botox, but anybody that looks bright and fresh, and if you look, when they do their facial expressions, they do have less facial expressions. So Botox is a medical drug, so it should be done by a doctor who has had extensive experience in Botox injections, because it's very important where you put the Botox what the final outcome would be. Experts agree that it should be an experienced person. And to the doctor, just getting the cheapest route, you might get a totally different result and outcome every time. So it's a medical drug, and it should be performed by a medical practitioner with proper training. And it should be performed in a medical clinic where we have proper medical evaluation, because it being a Schedule 4 drug, you have to have a proper patient history, proper evaluation, and then proper, sterile clinical settings. So,
how long does it last?
Depends on how many units you put in. That's also very important to ask your doctor, because very often they say they're going to charge you 900 Rand, but they could be putting in 10 units. So make sure that you're asking how many units they're putting per area. We normally have 3 areas on the face that we do. We have the horizontal lines, which give you those expression lines when you lift your brows up. There you normally need about 20 units. You have the vertical lines, those miserable frown lines in the middle of your brow that make you look angry. There you also need 20 units. And then around the eyes we also do about 20. But if you do all 3 together, you may get away with less Botox units. And the average patient in our clinic usually does between 40 and 45, sometimes 50 units. That's for a female dosage. But the men, unfortunately, it's going to be a bit more expensive because they have bigger muscles and they need at least 1.5 times the amount that a female needs.
So what does it do to take away the wrinkles?
It just relaxes that muscle. It takes about, depending on the Botox you use, there are 2 types, because Botox, the generic name is botulinum toxin, and there are 2 available in South Africa. So it just depends how long it takes to get into that little nerve, to relax that nerve, the transmission to the nerve, and then so when you do frown, you don't actually get the visible movement. And then it also depends on how long it takes to regrow that little nerve. And they've done trials after 10 years, and there's always re-innovation. So you will always get your natural look back, your un-Botox look back 3, 4, 5 months down the line. But you're never badly off, you're always better off.
And how long does it, it's a toxin, so how long does it last in your body? I mean, if you go every 6 months, is there a limit?
So once it actually gets into the nerve, it splits. And so the light chain does all the work and the heavy chain is actually completely useless. So once it actually gets into the nerve, it splits, so it's not Botox anymore.
Oh, right.
And as I say, it's one of the most widely researched and peer-reviewed drugs. There must be over 2,000 clinical trials that have been peer-reviewed, and it's been deemed completely safe by the FDA. And since 2002, 22 million vials of Botox have been sold and distributed worldwide.
We're discussing cosmetic surgery on Afternoon Talk with Dr. Maureen Allem. Our lines are open. If you have any questions, comments, give us a call, 0891 104 207. Your SMS is 34701 at a cost of R2. You can also send an email at safm.co.za. Is Botox only used to relax the nerves?
For cosmetic, no. There's, I think, over 300 medical conditions for Botox. It's actually a miracle drug in the medical world. You know, spastic kids who can't open their hands properly, or stroke patients who've got spasm in their hands and they can't brush their teeth, they can't comb their hair. They have Botox, much higher doses than we use in the aesthetic world. We give sometimes even 10 times the amount that we give, for facial Botox, and then that relaxes the muscles in their hands so that they can brush their teeth, comb their hair, and they also have to be, have it done 2-3 times a year. So it just makes it much more, daily living much better for them. It also takes away the pain from the spasms. It actually started about 15-20 years ago. There was an ophthalmologist in Vancouver, and she used to give Botox for patients who had blepharospasm, which makes you functionally blind. You have such bad spasm in your eyelid, So they started experimenting with little bits of Botox injections around the eyes to see which worked, because the eyelid eventually opened. Right. And then the patient came back and said, doctor, my wrinkles have gone on that side of the eye. And then she complained, oh my goodness, that's true. And then she went home to her husband, who happened to be a dermatologist, and she said, can you believe it, this patient looks amazing on the one side. So they did the other side as well, and then they realized this amazing drug for wrinkles. And then they started experimenting on the brow, and that's how Botox came about.
So how has the market for cosmetic surgery changed over the years? Who's going for more cosmetic surgery? Who's doing it less?
No, look, I mean, the average patient is 35, because that's when they start panicking. 28, they start seeing a little bit of crow's feet around their eyes. We're talking about women now. Men don't really, not so aware of what they look like. Not like the women. And then at 35, you start getting nasolabial folds, and at 40, you start getting the sagging. So the average patient is between 35 and 45. But because there's so much, media out about Botox, and people realize that the sooner you start with these non-invasive, non-surgical procedures, the better. So the population is getting younger and younger because they want to prevent these wrinkles.
All right.
Before it's too late.
Before it's too late, yeah. When is too late?
Look, too late is when they become very ingrained. Once the wrinkle is very ingrained. But you know what? Botox even works on an 80-year-old. I mean, I do my mother occasionally. Right. I mean, not very often, maybe once or twice. Once a year. And it's amazing the difference that it just relaxes that whole forehead and makes her look less stressed. So even at the age of 80, Botox will work on your forehead. It's quite amazing what it does. But the wrinkles around the rest of the face, that's when you've got to start much sooner, because that's not addressed by Botox. Botox is normally the upper half of the face. You can give Botox in the lower half of the face, but that's more for like a non-surgical jowl lift. But in the lower half of the face, we normally use the fillers and then treatments, all the laser rejuvenation treatments.
So does that mean there are different kinds of wrinkles that a person can get?
No, absolutely. You get dynamic wrinkles, you get static wrinkles. So Botox treats dynamic wrinkles. Now, dynamic wrinkles comes from constant movement of a muscle. So if you constantly frown, eventually you're going to form lines in between your brow. If you're constantly smiling and together with sun damage and collagen loss, you're going to start developing crow's feet. If you're constantly smoking, pulling on a cigarette or even chewing gum, or even like sipping on a bottle, you'll eventually form little lines around your mouth. I mean, I get a lot of women who are very distressed because they say they've never smoked, but why are they developing these lines around the mouth? And it's just basically, it's wear and tear. And eventually that skin can't anymore, it cracks up, and that's when you start getting the wrinkles. And that's why you've got to come sooner than later, because if you leave it too late, it's very difficult to get rid of those ingrained, I call them ingrained wrinkles. Then you've got to spend a lot of money and many treatments and more aggressive treatments to improve those wrinkles. That's why it's so important to come sooner than later.
Dr. Maureen Allem is a cosmetic surgeon. We're talking about cosmetic surgery on Afternoon Talk. Any questions you have, you can give us a call, 0891 104 207 is our phone number. Your SMS is 34701. Your email is talk@safm.co.za. Compliance to Employment Equity Act must be a business imperative. The Department of Labour will be conducting workshops across the country to provide guidance on how to prepare and implement employment equity plans, including preparation and submission of employment equity reports. These workshops will benefit employers or heads of companies, assigned senior managers, consultative forum members, HR practitioners, trade unions and employees. Stakeholders are invited to attend the workshop on the 27th of August at the Cider Park Hotel and Conference Centre in Johannesburg. The workshop will start at 10 a.m. to 12:30 p.m. and interested persons are requested to book by phoning Julian Mohale or James Molani or Ditsepu Peja on 0